Millions of people around the world are projected to lose their lives following the permanent withdrawal of American funding for aid. The American Secretary of State Marco Rubio announced the stoppage of the implementation of foreign assistance through U.S. aid. Washington says there was no transparency in the program that saw billions of dollars disbursed around the globe for different programs. Here's Brenda Wanga.
After a 64-year run, the United States foreign assistance administered through the U.S. aid has come to an end permanently. The Secretary of State, Marco Rubio, in pulling the plug on U.S. aid, stated that instead, foreign assistance that aligns with Trump's administration and advances American interests will be administered by the State Department. The agency provided aid to poor and third world countries around the world, with missions primarily focused on Africa and Asia. In most locations, U.S. aid concentrated on the provision of food and free vaccinations against diseases such as HIV, which is particularly prevalent in countries in sub-Saharan Africa. Families and refugees in the region have come to rely on this aid, and the withdrawal will hit sub-Saharan Africa hard as a region.
Because they're seeing the funding situation is going bad every day, the food ration is going down, and most of them are curious to know when is the situation going to improve.
That permanent cessation of humanitarian aid through U.S. aid is projected to have morbid impact across the globe. A report published in The Lancet projects that this will result in the deaths of 14 million people across the globe. The report shows that the withdrawal of humanitarian aid will adversely affect the health sector, especially HIV and AIDS management and prevention of malaria. In total, 14 million deaths are projected between now and 2030. Of these deaths, 4.5 million will be of children under the age of 5. The report further states that through U.S. aid, 91 million deaths have been prevented, especially those that would have been caused by HIV, AIDS, malaria, and neglected tropical diseases. Kenya is amongst those countries already reeling from the impact of the stoppage of this humanitarian aid, with programs like healthcare, agriculture, and community initiatives left with funding gaps and job losses. Marco Rubio has justified this move, stating that while America has funded humanitarian assistance, the recipients of the same have not reciprocated in kind. He says countries in sub-Saharan Africa, despite receiving $165 billion in aid, did not fully support USA interests at the United Nations, while those in the Middle East and North Africa favor China over the USA, despite receiving $89 billion in aid. The USA has also accused NGOs of misusing the funds at the expense of the American taxpayer. Brenda Wanga, Citizen TV.